Welcome to NARAL's The Morning After. Each week, our podcast brings you the latest on reproductive health care, progressive politics, and the fight to keep abortion safe and legal. You can listen to the show on Apple Podcasts, Spotify, Stitcher, Podbean, YouTube, and on our website at prochoiceohio.org. The program also airs each Friday morning at 9 on WGRN 94.1 in Columbus, Ohio. Follow us on Facebook, Twitter, and Instagram at ProChoiceOH. NARAL's The Morning After is a production of NARAL Pro-Choice Ohio. Enjoy the show!
Hey, I'm Gabe.
Hi, I'm Kelly Copeland. I'm saying my last name because there are several Kellys who work here now.
There's so many Kellys on our team.
Kellys are awesome.
No objection. Kelly, how are you? How have you been?
You know, it's been stressful like with everyone else. I have kids who work at a grocery store and a restaurant, and like everyone, thankful that we're all still employed and getting a paycheck, and that we're as safe as you can be. But I'm just so concerned about what's happening to people in terms of their health and their economic well-being and how things are going to go in our state and the country. So I think like everyone else, but I think the only positive thing I can say is that my new office mate is my cat Gracie. He is living what I believe is his best life right now. And so I guess that's the state of affairs here from Talmadge, Ohio.
Well, having a cat sounds great. I've got two middle school students who are just beating the snot out of each other at every moment.
My God. I really feel for you and all of the parents with the young ones. The kids that I live with are 21 and 19, so that's a little different, but probably a lot less stressful. So
right. Yeah. So you said in Ohio and across the country, and I feel like those are for the first time two kind of decidedly different set of criteria right there. I feel like Ohio, I feel somewhat positive that our state is all working together for the most part. And there's exceptions.
Notable exceptions.
We'll get to those, but for the most part, I feel that our communities are all working together to get through this as best we all can.
Yes. Yeah, I think so. I think that, so many employers like us immediately transition to staff working from home, doing things to really limit exposure to try to, lessen the curve. We're all learning this new public health lingo. And I think it's been really encouraging to see how many people are listening to the scientists, listening to doctors, listening to public health professionals, and every day, Ohioans and people across the country doing everything that they can to, slow this virus, but also to help each other, reaching out to neighbors to see, if they need anything from a distance.
Right.
Finding ways to share resources, whether it's the latest on how to apply for unemployment if you need that, or how to get food resources, or how to keep your kids occupied, how to manage all of those things. I've been really impressed too by all of the artists and the musicians and others who've been offering free programming, or even ability to support businesses by and artists by purchasing passes to online concerts, or buying takeout or different things. I just think the way that people are rallying around each other is really wonderful.
Yeah. You mentioned helping thy neighbor. That was actually something that was kind of unexpected on our block. Is my next door neighbor came to me and said, "Hey, she's got a daughter who's in college, and her physician just last week went into retirement. And the
Oh,
practice
wow.
was no longer calling back patients. This was her daughter is OBGYN. And she's like, we don't know how to get birth control anymore. and
Oh.
and oddly enough, I'm the guy on our block. Few people would think, well, the man next door knows how to solve this one, but I did, and I was able to email an OBGYN that works at Ohio State Medical Center and said, hey, my neighbor needs a referral. Do you know any private practices that are taking patients right now? And I was able to get her the information, and now she's able to kind of get that continuity of care with the new provider. Had we not been going through this, she probably wouldn't have thought, well, let's ask Gabe about a new OBGYN. So
Right. It's one of those sort of other duties as assigned things in your
yes.
job description when you work at NARAL. Somehow you become the referral.
Yeah. Which, I mean, we're happy to do so.
Of course.
Right. Okay. So everybody's working together, except we said there was an exception. Let's get to the exception. Tell me your thoughts on Dave Yost.
This is being broadcast, so I don't think I can. I will tell you some of my thoughts, not all of them. I think no one, absolutely no one, should be forced to stay pregnant ever, especially not during a pandemic.
Not forced to, right?
Yeah, it's just they should not be forced to stay pregnant. And here you have David Yost. If you don't know, he's Ohio's Attorney General. And it appears to me he's doing this, in collaboration with anti-choice groups like Ohio
Yes.
Right to Life, whose president is also on the state medical board. So if that's news to you, let that sink in about how inappropriate that is. And as of late last week, they put out letters saying that Ohio's abortion clinics, well, they sent letters to 3 of them saying that they should no longer be able to provide care. At least they worded it very, very carefully. But the what they're trying to do here is they're trying to set the wheels in motion to force Ohio's abortion clinics to close. And I think the way that they're exploiting this COVID-19 pandemic is disgusting. To take something so serious and twist it into a tool to force your ideological agenda on everyone else at a time when people are really vulnerable, it is just the lowest of the low, frankly.
Right. That's absolutely correct. So he sent out his order, and there was confusion about what that meant.
Yeah, a lot of confusion, which is terrible because everything's confusing right now. I mean, whether, we'll talk about it later, but, whether it's the election or, what is the status of your job? What are we supposed to be doing? I mean, all of that's changing moment by moment. And now, this guy rolls up and creates more confusion and, tries to give the impression that abortion clinics are closed, and that somehow they're not following the directives of the Ohio Department of Health, or somehow that they're not following the recommendations of the CDC, which is completely false.
Right.
When clinics got those letters, they immediately responded and said, of course, we are adhering to all of the orders from the Ohio Department of Health. Of course, we are conserving personal protective equipment and following the guidelines of the CDC. And why wouldn't we expect that? I mean, these are public health professionals. These are doctors and nurses,
right,
and people who manage public health facilities. Why would you think that they would be anything but that? Abortion clinics in Ohio must be among the most overregulated medical providers in the world.
Yeah. We that there's been for a decade now this attempt by elected officials, by administrations, looking back through the Kasich administration, there was always this effort to either imply, or sometimes they just directly stated that they thought, some abortion clinic in Ohio, if it was Planned Parenthood or one of the independent clinics, there was this claim that, oh, well, they're doing this and this is not right. At the same time, overly inspected, the dispatch showed a few years back that Ohio abortion clinics were inspected more than like 3 times as much as other providers. So with all of these inspections, there was never any actual evidence of anything being done wrong. Abortion providers have been following all the rules. And one of the key ways that we know that is there's been so many investigations and examinations and inspections that don't actually show any rule breaking. They're following the rules. They're doing the best practices to serve their patients and comply with the law.
Absolutely. And, the state itself requires reporting. It compiles that report every year. We know that abortion is among, if not the safest procedure that a person can have. The complication rate is always less than 1%, less than 0.5%. I mean, it's extremely low. And, our opponents, like Attorney General Yost, they really like to create this narrative that, somehow clinics are bad actors in the public health arena. And that just is completely false. And I think one of the other the other things that they're trying to do is say, well, abortion isn't essential care. Not only is it essential care, it's time-sensitive care.
Yes.
It's not something that you can just say, well, you're just going to hit pause on all of this. You can't do that without people facing, very intense ramifications. And, even I shouldn't say even, the American College of Obstetrics and Gynecology and 7 other major healthcare organizations, before David Yost sent out his letter, days before that, had put out a statement nationwide saying, look, abortion is time sensitive and essential, and it needs to remain available. And some states have said that explicitly. Massachusetts, I think Illinois, Washington State, a number of states have clarified and has specifically said that abortion care is essential care and that it needs to be among those essential services that remain available during the COVID-19 crisis.
Right. Yeah, I mean, my dentist has, told me for 2 visits that I've got a wisdom tooth, and they said you might want to take a look at that, have a oral surgeon remove that. That is not essential. It's something that once all of this is over, yeah, I'll schedule that procedure and get that taken out. But it's not like, my physical health is dependent on me having this, minor deal. My mom had a colonoscopy appointments that was scheduled for last week. That, of course, got canceled. Colonoscopies are important, but that's not essential health. She's fine today, even though she didn't get that colonoscopy. Those sort of things are not time sensitive. They can be pushed back. An abortion, everybody understands when, that needs to happen. When the person goes to the clinic for that care, if that doesn't happen, then the circumstances around that pregnancy dramatically change week to week. You can't just push these off because Dave Yost, has an opinion about them. So,
well, is Dave Yost a doctor?
Last I checked, he is not.
Okay, all right. Because I feel like when you're talking about a pandemic, doctors, scientists, these are the people who should be making decisions about what care can be safely postponed and what care cannot. Those are the people who should be making those decisions, I think, not,
Right.
Some politically motivated attorney general who, it's clear to me that they're coordinating with all of these anti-choice groups. And,
Yes.
and here's the thing too. I mean, if this was really about the COVID-19 crisis, why aren't they coming forward and saying, you know what, we're going to figure out how to make telemedicine for abortion more accessible.
Right.
The federal government could do that. They, require that a person get the medication for medication abortion in person. There's no study that says that that's medically necessary. That's been a political requirement. Our state is, considering legislation that would actually ban telemedicine for medication abortion. I mean, if this was really about limiting exposure, if it was really about, the not using protective equipment, limiting that, that sort of thing, there would be proposals that they could do. They could even make them temporary during, the COVID crisis. But no, that's not what they're coming with. What they're coming with is rhetoric that makes it sound like abortion providers are not public health professionals, that they're not taking all of the steps that of course they are to keep their staff and their patients safe. They it's just so maddening, because time and time again our opponents kind of come with this false narrative that whatever they're trying to do is about patient safety. And, even in the whole women's health case from the Supreme Court a couple of years ago, the sainted Justice Ruth Bader Ginsburg, called BS on that and said, come on. I mean, that was out of Texas. They were passing all of these over regulations on abortion providers. And she said, you can't just say it's about preserving the public health. You actually have to demonstrate it. And, so this is the modus operandi of, anti-choice politicians like David Yost. And we had hoped that they would put that sort of thing aside during the COVID-19 pandemic, but I guess we expected too much out of them.
Right. So then to clarify clinic status, what's the latest with the clinics?
The latest is they are complying. They have answered the ones who got letters from the Attorney General. They have, with their attorneys, answered those letters, that they are complying, that they are following all the recommendations, and that they're still open, providing services to their patients with all of those considerations in mind. So if you need abortion care, you can still get abortion care in Ohio. If you're having, and I would urge you, if that's something that you feel that you need, I would urge you to contact the clinic nearest you as quickly as possible. We don't know what the future might bring, whether this will end up in court at some point, or how that might work out. If you're having trouble with figuring out how to get to a clinic, or with expenses around getting a procedure, absolutely talk to the clinic nearest you. You can also go to the website of our amazing partners at Ohio's statewide abortion fund called Women Have Options Ohio, and they may be able to assist you. But it's really important that people understand that as of today, clinics are still open.
Right.
And they're providing safe, quality, affordable care that takes the COVID-19 pandemic into consideration, and that if you need that care, you should reach out as soon as possible.
Right. And for folks who are listening to this, if you're not in need of care, but you do care about this issue, we would also suggest Women Have Options, and we'll put the link for podcast listeners in the show notes, womenhaveoptions.org. This is their annual bowl-a-thon season. Of course, the actual bowling postponed. The fundraising that goes along with the bowl-a-thon, not postponed. They're a terrific resource to donate to. Their phones have been ringing off the hook with people who maybe just lost their job, but still need that procedure and need financial assistance. Maybe there's somebody who needs transportation to or from a clinic. Women Have Options are amazing. Stephanie Craddock Sherwood, their executive director, is a friend of the show. She's been on the podcast before. they need financial assistance to continue this. So if you're someone who's a pro-choice individual listening to our show, thanks for listening. And if you have a couple extra bucks to spare, womenhaveoptions.org is a terrific resource to donate to.
Absolutely.
Yeah.
Absolutely. I mean, and look, I understand that not everyone is in a position to donate right now. But if you are, please do that. The need for abortion care, the need for the assistance that people will require, the advocacy that needs to happen is all heightened right now. And so if you are someone who's in a position to do that, the message is, please do that. Your help is needed. And I know that when things like this go on, people always want to know, what can I do to help? That, even if it's, $5, $10, $20, if everyone who can do that does that, it makes a world of difference.
Right. And if people want to get involved on a more political, legislative angle, they can go to prochoiceohio.org and donate to us too.
Yes. And I have to say, to those who were part of the reproductive health happy hour that we did remotely last night, to people who are following us on social media, signing our petitions, calling and contacting Attorney General Yost, just want to say thank you.
Mm-hmm.
Thank you. Our organizers and Gabe and Jamie, our whole team, both those that you see often or hear often on this podcast, and those who work more behind the scenes. I just going to take a moment of personal privilege and say this team is fighting tooth and nail right now for you, even as they're all dealing with flooded basements and kids at home and spouses sharing offices and dogs barking and trying to get toilet paper, all of the things that everyone else is dealing with. I just want our supporters to know that the fight is ongoing and relentless, and we're keeping it going.
Right. We wanted to flag a couple of the resources, people who they can turn to online just for other general information. One voice who's kind of come forward as a medical professional who knows about this and is presenting information from a learned point of view, Dr. Daniel Grossman.
Yeah, I mean, he has long been, I think, an important voice about abortion access, about contraception. He is an expert on so many of those issues, and his presence on Twitter lately has just been really important. He's with the University of California, San Francisco. If you want to follow him, he's at DRD Grossman, which is GROSSMAN, Dr. Daniel Grossman. He has been providing an expert's view and an explanation of why abortion care is time sensitive, how many personal protective equipment pieces are used during procedures, how few actually are necessary. He's been talking about medication abortion. He's been talking about what organizations have been saying. And for anyone who has questions about that, I would really recommend following him on Twitter. He's a global expert on these issues, and we're really lucky to have his voice.
Right. Yeah, he's been involved in his own way on several of the issues that we've been facing over the years, including some of the harebrained ideas that Representative John Becker had, the let's transplant an ectopic pregnancy. Dr. Grossman is very quick to clarify, no, that's not a thing. You're just making stuff up and putting it into legislation. So
I mean, and honestly, I've had friends, people very close to me, who've experienced ectopic pregnancies, and prayed and wished that were so, that was an option, that they'd be able to continue their pregnancies safely.
Right.
A global expert like Dr. Grossman has to come in and fact check a legislator in Ohio who's putting forward this, science fiction version of whatever his reality is. I mean, who the hell knows what goes on in this man's mind? But I'm often grateful for experts like Dr. Grossman, but then sometimes I feel bad for them. I'm like, oh, you went to medical school, you've gone through all of this training, you've become a global expert, and what do you spend your time doing? Batting down nonsense.
Right.
I'm glad he's able to do it, but I wish it wasn't necessary.
Right. Okay, so we got like 5 minutes left here. Somebody else that people can follow on Twitter for good information, especially since the primary has been officially rescheduled. I'm just tacking on to the end of our agenda here. Is ACLU of Ohio.
Yes.
They're great partners and really important in clarifying how and when people will be able to vote, because the primary was extended. It wasn't postponed really, because people have been voting. How's this working?
Well, like everything, it's confusing. Common Cause Ohio is another group who's working on this, and I'm actually looking at a graphic that they put out on Twitter about what is the latest information. So absentee voting has been extended through April 28th. So if you've not voted yet, you must request a ballot by visiting voteohio.gov or your local county board of elections. They are saying you can also call your local board of elections because, hey, we're ordered to stay at home and not everyone has a printer. So according to them, you can call your local board of elections to request an absentee ballot. Once you get that in the mail, you need to get it back. It has to be postmarked by April the 27th or turned in to the county board of elections by hand up through, I assume it's 7 or 7:30 on April 28th, which is the deadline for getting your absentee ballot in. My understanding is that if you are not able to do that, perhaps because you are dealing with domestic violence or some sort of a disability, that you can talk to your county board of elections, and there may be some other options available to you. I don't have the latest information on that, but if you haven't already voted, please do everything that you can to get an absentee ballot and get it back in time. If what's happening in this pandemic shows us anything, it's that elections matter, and that the people who are in office can have a life and death and a profound impact on yours and your family's well-being and in your lives. So, now more than ever, voting is important.
Right. You can get more information on all of that at voteohio.gov. That is the Ohio Secretary of State's website, which has been reconfigured to now include all of the information that the state legislature just yesterday voted to approve. There was a bunch of confusion about the primary when it got postponed, but now it does appear that all of the Republican and Democrat, House and Senate, and the governor's office, all on the same page, moving forward. You've got more than a month now to get in your mail-in ballot to continue to vote in the primary. If you go to prochoiceohio.org, you'll also be able to view our primary endorsements. It's right there on the front page of the website. Click on endorsements, and you'll see the candidates for the state legislature that have been endorsed by NARAL Pro-Choice Ohio. So check those out. Visit voteohio.gov, and you can still vote in the primary election.
Please, please vote. We don't know how all those things are are going to turn out, if there'll be any legal challenges. So, and a month sounds like a long time, but when you're talking about boards of elections, fun fact, when I was in college, I worked for the Summit County Board of Election. That can be a short amount of time for them to get a lot of new absentee ballots printed, get them mailed out, for you to be mailing things back. I don't know if the rest of you have been watching the letter carriers and the other delivery people from FedEx, UPS, Amazon, just hustling.
Yep.
A month isn't a ton of time. Every day when I see my letter carrier come whizzing by, I mean, I've never seen them moving so fast. So they're doing the best they can, but they're really overloaded right now. So don't horse around. Get on top of it if you
Right.
can.
Yep. Okay. So everybody take care. Protect your health, protect your vote, protect your rights.
Yeah.
And we'll see you all next week.
Take care, everybody.
Okay. Bye-bye.
Bye-bye.